back with Dr. Beck, a person who is specialized in nerves, in physical therapy, and in, all kinds of treatment, such as weaning people off of medicine in terms of pain management if and when they have major pain. And Dr. Beck, has a few interesting viewpoints on surgery. None of us like surgery, Dr. Beck. There's no doubt about it. Most of us don't even like to go and take blood, for a blood test. Never mind getting cut. We're all a little worried about it. And yet, we seem to be falling prey to a assertive MD, who says, well, that knee, that meniscus, that thing, it needs to be cut. You're 50, you're 40, that's just how it goes. Gotta cut it. Be it on the toe, be it wherever, the back surgeries, the neck surgeries and all that stuff. And yet, there's a tremendous amount of people out there who actually, in the hospital, get infections. The surgery may have gone well. It might even have gone well. But the infection they catch is literally deadly or life changing for them. Tell us a little bit about it.
Well, I think the point that people should understand is that I would estimate about 90 to 95% of orthopedic conditions that they go see an orthopedic surgeon for don't require surgery. So that means that 90 to 95% of orthopedic conditions we can treat without surgery. And so that's an important point. Now, if you need surgery, you need surgery. But there's a lot of things you can normally do before you proceed with surgery, and so if you're not ready for surgery, why go see a surgeon? You can come see us. We can treat the majority of orthopedic conditions that don't need surgery with a lot of different techniques, including medications, injections, therapeutic exercise, as well as specific testing, such as nerve testing. Now, if you have surgery, this is a major procedure. Whenever you open the body up, you run the risk of developing complications, and any surgeon will tell you this. You have a risk of infection, bleeding, bruising, reaction to medications. There's a variety of things that can happen. And so, surgery is not something you necessarily want to go into lightly. Again, if you need it, you need it. But, again, there's many conditions and many things that we can do before you necessarily have to go to surgery.
Okay. Now, give us some of the... I heard some examples where people walked in a surgery room for which is by the surgeon deemed a relatively minor surgery, while yet having, of course, to sign all kinds of consent forms, which is understandable. It's fine. But so the people walk in with that surgery, and then they walk out with an infection they caught in the hospital. I don't know what the name of it is, but there's one very, very famous one. And literally that infection may put them in a hospital and in bed for a long, long time. What is that? Do you know what I'm talking about? Because I really don't know the names of it.
Well, I think you're talking about the methicillin-resistant staph infections that people frequently get in hospitals that are basically resistant to antibiotics, and or maybe one or two antibiotics may help it, and it can be devastating. You may never get rid of the infection. So this can lead to problems such as infected prosthetic joints, infected joints where you have to take the prosthesis back out. It can be a real problem, and hospitals are crawling with these type of bacteria. So this is a very big problem. And again, when you open a body up and expose it to these pathogens or bacteria, you take a definite risk.
Okay. Now, what about... you said that, you do the therapy and all this type of stuff, but there seems to be something else. I don't know whether the word steroids is correct, and it's not the type of steroids, the people take who then get banned from playing football, but apparently some other type of thing, where you literally, whatever it is, again, I just... The nomenclature is not exactly I'm strong at, but I hope you understand. Why don't you talk a little bit about that part also, which you seem to be, it's part of your practice.
Yeah. We can do a variety of injections, particularly for sports-related type injuries. For example, we can inject sore shoulders or tendonitis in the shoulders, tendonitis in the elbows. We can inject the carpal tunnel if people have carpal tunnel syndrome. And what we do is we put in a small amount of steroid to help calm the inflammation down. But this is not the amount of steroid that causes you to kind of blow up or make your blood sugar go up or have a lot of complications that people get when they take steroids by mouth. Other conditions that we can inject include bursitis in the hips, arthritic knees, plantar fascial pain, pain in your heels where you can inject steroid in there. People often do quite well with these injections, and frequently one injection may take care of them.
And in many cases, literally eliminates a surgery?
Oh, absolutely. And absolutely, it removes the need to come back and see the doctor.
What was that last thing you said?
I said it removes the need to even come back and see a doctor, which is even better.
Wow. How do you stay in business?
Yeah, I know. You can't do it too well.
All right. Absolutely fascinating and very, very interesting, for me. I have always tried, and so has my wife, even way before we met, tried to live off the medicine. I took a fair amount of them when I was a kid. Mom gave them to me, not knowing any better. But the second I moved out of the house, which was around 18, I think that was the last time I took any type of medicine except going to a dentist. And I usually associate with people like you, who, kind of like fix everything. I had a small incident myself where I hurt myself lifting a baggage, a luggage, knowing how I'm supposed to lift. I, of course, neglected it. You load your car, you don't pay attention. It's supposed to be light, but it's heavy. And next thing you know, it's bang. And I heard, and it was devastating. I was like literally paralyzed for 2-3 days. Finally made it to a chiropractor, relieved it a little bit, lots of cold ice. It didn't go away for a long time, and there was actually some people who said surgery is the only way out of it. You know what I mean? And some other guy just said, why don't you buy this machine, which is called an inversion table, hang up there upside down. It costs a couple $100, put it in your living room. And I said, all right, I guess I can hang upside down. And he explained to me that Hippocrates, the guy, the father of medicine, hung his people from his legs. I said, fine, I'll do it. And holy and behold, I mean, I am a cured guy, literally. And, every so often I have a little bit of back pain, I suppose, but at 58. And I hang on up. I should probably hang on it every day, but I don't. I'm one of those lazy guys. So when a little bit of discomfort comes, I hang on it a day or two, and it's always gone for months at a time. Somebody told me I needed surgery, and I guess I really didn't, did I?
No, not necessarily.
Wonderful. Well,
and I see a lot of people like that with neck and back complaints where we do traction, a $15 traction unit, and it fixes them. And they didn't have to have surgery. That was it.
Right. So, proper diagnose, where's the problem? Because obviously you can't shoot something you don't know. You can't hit the target you don't know what it is. And whether that is to destroy it or to fix it, you just can't do it. And so, and I really think that's where you are, and that's where most of you pain management guys and physical therapists and you with the nerve and all those things come in, where look where it is and then do everything possible to fix it. The body does know how to cure itself if you give it help. And yes, as you said, every so often if this fails, but look, tell me, when does a person know that, look, what we do doesn't work? Does it take 10 years? Does it take 2 years? Does it take a half a year? That you say, look, we tried it, we did it, here's the deal. I guess surgery is the last option because there is nothing we know we could do rather than that. More or less, what's the time frame there? How much time does a person lose till he still can go and do the surgery if he really wants to?
Well, I would say on average, 4 to 6 weeks, we pretty well know that conservative care is not going to help you. 8 weeks on the outside, so, you've wasted a month, maybe 2 months. But if it works, you don't need surgery. So I think it's a pretty minimal investment in time. So, I think a very short period of time, maybe a month or so, and then we kind of know where things are going. And, gosh, maybe we ought to look at surgery for your problem if you're not getting better. But, 4 to 6 weeks is very typical.
Wow. I mean, that's incredible. Even if it is 2 or 3 months, kind of to say, well, let's give this more time, And during that time, you will be able, obviously, to keep the person out of as much pain as anyone else would also, right?
Oh, absolutely. And during the recovery process and the rehabilitation process, one of our goals is to manage the complications and the pain that goes with the rehab. And sometimes pain will go up a little bit, and, we try to take care of that. And like you said, many people will want to wait 2 to 3 months before they kind of throw in the towel, so to speak, and make sure that the conservative care is not going to help. Even if they're making small progress, they can see it, and so they may wait 2 to 3 months before they really say, hey, let's try something else.
Right. Wonderful. Absolutely wonderful. Let's escape that knife as much as possible. Even though, thanks God, people are here to know how to cut us when we do need it, but, let's make it the very last option for real. Thank you very much, Dr. Beck.
Yeah.